Find out where we are now, 2 years and millions of swabs later.
We all see them, masks abandoned on the side of the road. It's a reminder of how far-reaching the COVID-19 response has been over 2 years, and how far we've come in fighting it off. It wasn't too long ago you couldn't go out to eat, everyone stayed in their homes, and family members didn't see each other for months. So if the pandemic strikes again, will we ever go back to the dark days of the lockdowns?
No. I think a lesson learned was that's not where the United States public wants to be.
It may not be likely for the future, but that's where we were 2 Marches ago. Schools had already been closed on March 13th, before Governor Justice declared a state of emergency on the 16th. Restaurants, bars, and casinos shut down the next day, and the stay-at-home order went into effect the next week. Gamble remembers a complete shift of normal health department work to virus-related efforts.
And that could be everything from environmental programs, we had to modify those, to our clinical schedules. We were now into COVID. We needed to focus on that.
Now in 2022, the response to the virus is ingrained in our lives. It isn't uncommon to see someone with a mask on at the grocery store or those social distancing stickers that are still on the floors of businesses. But 2 years ago, medical masks were for surgeons, and no one had ever heard the phrase social distancing. Gamble says the health community had to change their recommendations as we learned more about COVID.
We can't assume what we learned back in 1918 or 56 or polio or whatever infectious disease is going to be the same right now.
He adds that just because the guidance changed doesn't mean that anyone was intentionally hiding data. The health departments worked with the information that was available, even if hindsight shows us the lockdowns could have been handled differently.
It's what we had, especially on a local level, whether it's Ohio County Marshal or Belmont, what we had is what we put out.
And no one wants to hear it, but we could have another wave on the way. Cases are increasing in Europe and Asia and could be headed here after a short delay. Health departments still say vaccines and boosters are the way to keep yet another wave from spiking too high. So as tempting as it is to say we're all finished with this years-long drag on our lives, don't throw away your mask just yet.
We're not done with the pandemic. The pandemic's not done with us.
Now, West Virginia has bounced back from the pandemic in other ways. Just this week, the state hit its record low unemployment rate of 3.9%. Live in Wheeling, I'm Colin Roos, working for you.